The first stop in Samantha's exciting journey is a consult with Dr. Robert Tornambe, Chief of Plastic Surgery at Cabrini Medical Center.
Nice to meet you, Doctor.
Nice to meet you. When I first saw Sam, the first thing that struck me was her bone structure. I just saw tremendous potential in her face. I said, this is a beautiful lady. What bothers you most?
Basically an area here and around the eyes, a little crepiness, and a lot of wrinkling, which I know is an indication of life struggles, but I'm kind of starting over in life, so I want to present a youthful, energetic facade.
So one of the things we think about is raising your brows, ever so slightly. And at the same time, laser your lower eyelids, and that would take care of the little fine line wrinkling that you have. A facelift involves incisions in front, starting in your hairline, going sort of in front of and in your ear, and then going behind your neck. What we would do is tighten you up, both your skin and the muscles underneath. It'll improve this line here, which is called a nasolabial fold, but it will not eliminate it. To eliminate it, I'd have to really pull you tight, and it just wouldn't look natural. You have fat in your neck, which is nice. So once we tighten things up just a little bit, it'll resume that very young contour, which is very aesthetically pleasing.
The doctor did such a terrific job of explaining everything that, no, it doesn't sound scary at all. I feel exhilarated, excited, ready to start over.
Samantha is getting a full facelift, a brow lift, fat injections to her lower eyelids, laser skin resurfacing, lip augmentation, and a new dental bridge. Samantha heads off to Dr. Tornambe's office for surgery.
It's amazing when I think about where I was a week ago, and here I am today, just ready to go.
And I'm just going to make a lot of marks.
Dr. Tornambe uses precise marks to make sure nothing about her surgery is left to chance. He uses a red marker to make sure he always knows where the critical facial nerves are.
Can you imagine how hilarious that would look?
Okay, we're going to get you in the room and get started, all right?
Some big deep breaths and go to sleep now.
Good.
Dr. Tornambe begins with Samantha's facelift.
Because she has a high forehead. If I made the incision in the hairline and then pulled her up, it would make her forehead even higher. So by just hugging the hairline, I'll still be able to pull her up a little bit, and I'll actually shorten the forehead, which is a much more youthful, better appearance.
Next, he moves on to her neck.
Is the edge of her muscle that's separated, that's normally in the midline. And if you look at her pictures, you can see it's called a platysmal band. You can see them very nicely. You know, we want her to have a nice smooth neck again, so what I'm doing is dissecting those out, and I'm going to suture them back to where they belong. We're now ready to do the cheek part of the facelift, and then at that time, when I get exposure, I plan to inject some fat right into these two spots right here below the eye.
Dr. Tornambe finishes Samantha's surgery by resurfacing her face with a laser.
All set? You can see the skin contracting. Okay, off. What we're doing is wiping away desiccated skin, the outer layers, that the laser just blasts away. This is all dead skin. The last little tidbit we're going to do is augment her lips, make her lips a little bit bigger. And that will do it in about a week after the swelling has gone down. How's she feeling? I think she's a little gorgeous. She's got great bone structure. She's a very pretty lady, and she was a pleasure to work on.
Her surgery over, Samantha has a hard time coming off the anesthesia.
Sam, you okay?
Take a big breath. Okay, take a big
nice,
breath.
big breath.
And we'll just stand here for a sec. You're doing great. North. Sam, you did awesome.
After a long day of surgery, Samantha finally begins the healing process. He then checks on Samantha, who is still dazed from the potent combination of surgery and general anesthesia.
Smile for me. I know that's hard. I just want to make sure your muscles are working nice. Good. Now show me your teeth. Great. Looks like everything's working fine.
My teeth.
Well, I just want to make sure your muscles are working in your face. And we're going to take those drains out. Those nasty drains are coming out. I think you feel a lot more comfortable. If you saw yourself, you'd be pretty shocked, but from my point of view, you look great. Now we're just going to put a light dressing on you. I always tell my patients the first 24 hours is the worst. From here on in, each day is 100% better. Hi Sam, how are you?
But for Sam, seeing her new face for the first time brings a very different emotion.
When I look in the mirror, I can kind of imagine my face without all the redness and the soreness. The new face looks exactly like me. It just looks a lot fresher and healthier, and it looks very rested.
Your incisions in front of your ear are healing beautifully. And now it's just a matter of continuing to allowing the body to heal. But you're well on your way.
Oh, that's so good to hear.
Next, Sam gets radiance injections in her top lip, which will give it a fuller, more youthful appearance.
Radiance is a fairly new product. It's an organic product. The advantage is that it seems to last. The longest study now is 4 years, and the product is still in the location that it was injected and has not gone away. Sam, we just plumped up her upper lip, just the final finishing touch, and I think that it'll be a nice little improvement.
I'd give you a kiss if I could.
Was Samantha Myers 6 weeks ago before her extreme makeover.
The lines on my face are like a badge of the life that I've led, but I think it would be so fun just to feel really pretty and feminine.
Back in Littleton, Colorado, it's Samantha's turn to astound her friends and family. In a classic limo, this classy lady is heading to her big reveal party.
I feel different somehow. I do feel, I guess, you know, from that old musical, I feel pretty. I think that just about sums it up.
All her friends, including her 2 best friends, her twin daughters, are waiting to see the results of her remarkable extreme makeover. After 6 long weeks, the self-sacrificing single mom has returned home on top of the world.
I think that my mom is going to have a new attitude towards everything she does and just have new confidence to do whatever she wanted.
I expect to see a little Elizabeth Taylor, because to me she always looked like Elizabeth Taylor.
I'm very excited to see what she looks like because she's beautiful anyways, so I think that whatever has happened or what transformation she's gone through will just add to that.
And now, it's time for Sam to amaze all her friends and family.
I think that this is the beginning of a new life for my mom. I think everybody here knows that, and that's why we're all so excited.
Wow. She's always been beautiful inside, but this is such a transformation.
I almost didn't want to touch her because she looked so perfect. Accessories are perfect, the makeup is perfect, the hair is perfect, and perfection.
Samantha had a full facelift, a brow lift, fat injections to her lower eyelids, laser resurfacing, a lip augmentation, and a full dental restoration, including periodontal surgery and new bridge work.
There is a passage in Matthew that says, "Wheresoever lies your treasure, there also lies your heart." And more than ever tonight, I realize that my friends are truly my treasure. This is also absolutely one of the happiest nights of my life because it's that great excitement of a new beginning, of going on into the future.